Dr. Juliette Tuakli is a world-renowned pediatrician and chair of the Board of Trustees of the United Way Worldwide, the world's largest privately funded nonprofit organization. She happens to be the first woman to occupy this post in United Way's 135-year-old history. She is founder, CEO, and medical director of Child Accra, a full-service clinic that provides clinical and public health care services to children and their families across West Africa. I should also add, in another first, Dr. Juliette Tuakli is the first African woman in history to hold a senior faculty position at Harvard's Medical Center. She is also a fellow board member with me on Mercy Ship's International Board of Directors. Thank you for joining us, Dr. Tuakli.
It's a pleasure to be here. Thank you.
Dr. Juliette, let me start with you. Can you help us unpack the difference in the way the virus is behaving in Africa compared to the US, Europe, and elsewhere? Is the difference real, or is this a matter of how we track infections and health outcomes in Africa? And if it is real, what accounts for this difference, and what lessons can we learn from this?
I think the difference is real. But before I start to say why I think the difference is real, certainly from the medical perspective, we have a very young population on the continent of Africa. Young insofar as our average age tends to be below 21 in Africa, as opposed to in Europe, where we have a much older population. We have fewer elderly persons in our communities. We have about 3% on average across the continent of our population being elderly, as opposed to 20 to 50% in Europe and the US. And as you know, the elderly are particularly susceptible to the COVID-19 viral infection, the ill effects of infection. And I feel that we also have a much more active population, in part because it is young. They are also much more active. The activity enhances the immunity towards viruses in general, and allows, I think, a milder form of the illness in general to occur. I do believe that some of the comorbidities that make the virus worse in our population is exactly the same as in the West. And I'm speaking about things like hypertension, premorbid hypertension. Obesity is big. It's a biggie insofar as there is, one can see that the effect of obesity definitely is to worsen the outcome of the virus. And any other chronic illness, pulmonary, in the lungs or in the kidneys, which we do tend to have on the continent, but remember our population is younger, so the extent of the damage is not as marked as those in the West, where they do have chronic illness in the lungs or in the kidney, it's usually much further along because it's also goes along with age. I think also that looking at the illness itself, many of its effects are not that dissimilar to other illnesses that we have on the continent, and I'm thinking particularly of malaria. Also, as you know, on the continent, we do lose a lot of our mothers after birth due to hemorrhage. The process whereby the postpartum mothers move into that dangerous form of hemorrhaging is in fact the same process that occurs in COVID-19.
Wow.
The disseminated intravascular coagulation. The same pathophysiology is occurring. So the question that raises to me scientifically is, do we have some residual defense in the form of some immunity against some of this because of the fact that we've already experienced some of these factors in our regular exposure, especially in parts of the continent which are endemic vis-a-vis malaria and other illnesses? I will say that it is also important to note that previous epidemics and pandemics, such as the Ebola epidemic that we've had in various parts of Africa, have in fact prepared us community-wise in many ways for early identification of illness and early response of those in contact with the index cases. One should never forget that on the continent, and especially in our part of the continent, in West Africa and in other parts of the continent, before one even resorts to using medicines bought in pharmacies, we always have some initial access to our traditional medicines. And in looking at our traditional medicines, I think it is no coincidence that the medicines, the local medicines that are beginning to pop up as being solutions to COVID-19, for example, in Madagascar, contain the very same substances that we use traditionally whenever fevers occur, for example. And here I'm thinking of a plant, Artemisia, which in fact is what used to be the bedrock of many anti-malarial medicines, and to a lesser extent still is very significant in that regard. But we have other things such as the neem tree and the products of the neem tree, which have always been used traditionally where a person is ill, especially if it's connected with fever. And these are medicines that we're used to taking either on a daily basis to protect ourselves or in response to any kind of illness or ill health that occurs. And I think that does build up a reservoir that protects to some extent, in addition to age and the other factors, lack of obesity, active population, etc., etc.
But you mentioned something about the hemorrhaging of women in afterbirth. And that reminded me of the Lancet Global Health Journal that says that disruptions of essential health services for mothers and children due to COVID-19 could be more catastrophic than the virus itself. And Lancet indicated that in low and middle income countries, and we know in Africa we have a lot of those, that this region of low and middle income countries could be experiencing 1.2 million child deaths and around 5,700 maternal deaths in the next 6 months if nothing is done to support mothers and children with essential services, health services. Because with all of the focus being on COVID-19, there are some other services that are being ignored. Now, just based on your experience, what should African governments be doing to ensure that mothers and children are not neglected during this pandemic, but rather supported, despite the need to keep an eye and focus on COVID-19?
I do think it's important to recognize that it's not that children do not get COVID-19, they do, but it is a much milder illness in children. It's anything from a mild flu-like syndrome to a full-blown Kawasaki-like syndrome, which so far on the continent has been relatively rarer than in Western countries. Kawasaki itself generally has been rarer on the continent than here. Whether that's because of people using aspirin quickly here, I don't know, but that is the reality. What is also the reality is that meningitis, malaria, especially malaria, will kill 10 times more people, actually, during this epidemic or during this pandemic than the virus itself. And it's really important to make sure the private and public health sector has access to essential health services, which include vaccines. At the beginning of the pandemic here, there was a little epidemic of meningitis occurring in the northern part of Ghana, and people were dying. Meningitis vaccine was hard to locate. Nobody could buy the thing because it wasn't there. everything was directed to COVID-19. And I mean, that is most unfortunate. So that's an example of why it's important to ensure that our basic mandatory vaccines are still stocked up and in stock during this, so that the children and their parents can be encouraged to come for routine health care. Routine health care is a concept that is beginning to take root. Ghana has done a lot of work in that regard to have parents understand the need for children to be seen regularly, not just when they're sick. And to lose that momentum now would be most unfortunate. So I really think that the message still needs to go out that the children need their regular checkups, regardless of whether there is illness going on, and particularly, of course, if there is illness going on, and that the facilities that are available to them and accessible to them are fully stocked with the usual panoply of medicines and vaccines and medical staffing, medical personnel. Yeah.
Dr. Tuakli, as a pediatrician who has seen just about every childhood infirmity known to man, you've seen it.
Alas.
Yeah. And what can you say to parents who, quite frankly, are very scared right now? They're very scared about this rare inflammatory disease with Kawasaki-like symptoms. I mean, if you hear about it in one part of the world, you're going to get nervous because, after all, the coronavirus didn't start in Africa, but it's now spread from China. So parents are saying, well, what about this rare inflammatory disease among children? It may be starting in the West, but perhaps is en route to Africa. What can you say to parents? How do you speak to their fears about that? How can they protect their children? What do we know about this rare inflammatory disease?
First, you must know that it is not that common on the continent.
Okay.
It absolutely is not. Even when there is no COVID.
You don't think it's on a ship somewhere in a package?
Even when there is no COVID. I say this having realized that we started having pediatric COVID cases in Ghana as early as January.
Wow.
Before the March announcement. A good full 2 months before the March announcement. We saw several children with strange illnesses, some of which looked like a mild version of Kawasaki. Kawasaki has a very characteristic rash, but there are lots of other symptoms that the children had and were having and are still having when they're exposed to COVID-19.
So is there any peculiarity about this rash? Because we know children get rashes. How do I know that this is, how do parents know that this is?
It's a very diffuse rash. But because we in Africa tend to be of color, if I may say, it's not as marked as it is in white populations.
Okay.
Yeah. However, if you have a child that has fever, has had a runny nose, and seems to have a chronic cough like that, I mean, as though clearing the throat, maybe coughing at night as well, developing this rash, which is itchy.
Okay.
Which is itchy, that is one of the characteristics. Certainly it is something that one has to bear in mind. But I will reiterate that in children in general, and particularly in children on this continent, the manifestations of COVID-19 have been particularly mild. They have been prolonged, but mild. And they've been very much lodged in the lungs and on the skin through this manifestation of various, and it's not just the Kawasaki rash. There are other rashes that we have seen. We've seen rashes that look a bit like chilblains on the fingertips and on the tips of the toes. And that's really an unusual thing to find here because the weather is not cold enough for one to have chilblains. And so to have a child presenting...
So is this like a frostbite?
Like a frostbite.
In the tropics?
Yes, in the tropics. And of course, that should alert anybody to the question of COVID-19, yes, because that is not a normal finding in this part of the world. But of course, the difficulty would be if you were in the West, you know, I mean, then of course you would have to look at the environment and see whether this was appropriate or not for that stage
Do you
and
think it's targeting
temperature.
a particular age group of children?
That
Or
is a little
should-
difficult.
Yes,
I think
okay.
that when I look at both what I've seen in others, the story of other doctors, I don't think there's been a particular age group. We've seen children as young as 18 months all the way up to 12, 13, 14. And again, one should never forget, in Africa we have sickle cell. That is a chronic illness, and definitely depending upon how serious a child has been affected by sickle cell, for example, if it's a full-blown sickle cell situation where they have already got chronic damage done to their lungs, the lungs, the liver, the spleen, and sometimes even the kidneys, they will have a worse presentation, if you will, of COVID-19. And the difficulty will be to know whether we're looking at a severe sickle cell crisis or whether we're looking at COVID-19 due to the fact that there is an underlying chronic illness. So that is important in Africa to always bear in mind, whether there's a family history of sickle cell or not.
COVID-19 presents a multifaceted problems that require multidimensional solutions. And in addition to the medical treatment that you're offering, people are also coming to you. You see them spiritually sick. You see also a rise, I'm sure, in the depression. We're even seeing globally, I don't know if they keep the statistics in Africa, a rise in suicides. Some people say it's the isolation. But what we know that COVID-19 is not just presenting an illness with the virus to the body, but to our faith and spirits and all manner of issues. How are you treating that how do you speak to people's faith when you see them?
You're absolutely right. There is a huge rise in anxiety and a sense of hopelessness against this unknown invader, if you will. And certainly a rise in the amount of depression across all age groups, actually, even younger children recognizing the anxiety and depression in their caretakers and recognizing they cannot do the social things, the normal social things they would do, begin to turn inwards and become withdrawn and have issues with sleeping, eating, and clearly it is mostly manifest behavioral but spiritually evoked.
So are you seeing this depression? Is it possible for even young children to be depressed?
Absolutely. We have children, when children are anxious and can't obtain relief from their caretakers, they, more than anything, have a chronic abdominal pain or headache, but they don't know what a headache is, so they'll just say a pain somewhere in the head. But we've seen so many cases of abdominal pain, I can't begin to tell you. And it is one of the manifestations of child anxiety. Childhood depression tends to manifest either by withdrawing or acting out. So children who normally have been placid and pretty well behaved suddenly start becoming oppositional and throw tantrums, even though they're out of the age of being tantruming, in part because there's a sense of not wanting structure. They want something and they don't know how to articulate it.
Hello, I'm Rosa Whitaker, President and Vice Chair of Dominion Television. Thank you so much for watching our YouTube channel. If you like this video and the content, please click the subscribe button below and join us on this journey. Our journey is to lead by our faith and reclaim the prevailing culture and the airways for Christ. Thank you so very much. May God richly bless you.